Meanwhile, our top story tomorrow is the big White House healthcare summit. President Obama's push to have high-ranking lawmakers on both sides debate to reach a bipartisan deal on a bill, if that's possible.
Can this meeting save the health care bill? Republican Congressman John Kline of Minnesota is attending the summit. Congressman, what do you expect to happen? What have you been told to prepare for?
Well, we're hoping to have a real bipartisan discussion, but I've got to tell you that I'm pretty disappointed because the starting point seems to be the president taking 2,700 pages of legislative text that passed the Senate, making some minor tweaks and bringing that forward as a starting point. And that's a shame because Americans have been very clear that that's not what they want. They've spoken loud and clearly all through the summer, through the fall, through emails, through how they voted. That's not the place to start. We ought to start with a blank piece of paper and see what it is that we can agree on.
Well, unfortunately for your side, that's not going to happen. The White House has made it pretty clear, Congressman. But you are one of 19 Republicans who are going to sit down across the table from the president and his team tomorrow at Blair House. What expertise do you bring? What are you going to be able to, how will you counter the president's argument?
Well, I think that we collectively have put together a pretty good team on the Republican side, the House and Senate. Some of us have expertise in some areas. I'm the senior Republican on the Education and Labor Committee, so employer-provided health insurance is something that I've looked a lot at. But the point is we're going to bring in good market-based solutions. We've got some ideas that we think we ought to put forward on the table, have a discussion, and see if we can't move forward some incremental steps towards lowering the cost of health care and allowing more Americans to be insured, allowing people to buy insurance across state lines and things like that.
Well, Congressman Kline, I know the schools are good in Minnesota, and I hope you did well in math, because you might want to bring your calculator when you show up tomorrow. Here's what the American public, I don't think, realizes right now, is that that sweetheart deal that, that the senator got in Nevada, the Cornhusker kickback, isn't it true that now every state's going to get that as a result? And also that little kickback that the unions got with the Cadillac plans, isn't it the case now that everyone's going to get that? So isn't it the case that this bill is much more expensive than originally thought?
It is very expensive, and the projections coming out of the Congressional Budget Office don't even account for the full cost of this thing. When you look at how it's phased in with when you start to get benefits and when you start to pay taxes, the cost is going to be enormous. There are budgetary gimmicks in this thing that are very, very troubling. Nobody really believes on Capitol Hill that we're going to force doctors to take a 21% pay cut in Medicare reimbursement, and yet that's the kind of math that actually no calculator can solve that's in this bill.
Well, we're going to watch it on television. There aren't going to be any more secrets. So for 6 hours, not including lunch, we'll get a chance to see you and your colleagues and those on the Democratic side go at it.
All right, Congressman Kline, John Kline, Republican from Minnesota, thank you very much.